So the first, thing I have a question to all of you really is, one, why does your organization, clearly all of your organization have prioritized the voices of women in your work? Why do you think it's actually important? And, what have you seen come out of that, of your experience in terms of engaging this? But you can go first.
Okay, I'm going to start with a personal story about why this means a lot to me. I talk about a young girl who's 12 years old. She's very impressionable. She's really much older than most of us here. She's an older woman now. But she was 12 years old when she loved to sell oranges outside her father's house. Very impressionable young woman who eventually got pregnant. Now, this woman's life will be a tale to everyone in her family, every young girl in her family. She will be stigmatized and she will be the face of, how to put this, an immoral young girl. So every time you're reminded with her name not to be like that. Let's call her Stella. You must never be like Stella. You must never be useless like her. You must not let yourself go like Stella. Stella was terrible growing up. But Stella was 12 years old. When I was younger, Stella was terrible because that's what I was told. But then when I grew up and came into the understanding of what life was and sex and marriage and pregnancy and giving birth, I realized Stella was 12 years old when she got pregnant. I don't know anywhere else to put this, but Stella was raped. Stella was raped by a 40-year-old man. I don't know what he said to her. I don't care to know, but there's no other way to put it because she's 12 and he's 40, right? Guys, Stella is my aunt. And today, the 18th of October 2019, is Stella's funeral. Stella died maybe about 4 weeks ago. Imagine I was in an event when I heard about it. And since Stella died, I've just been thinking about all the work I've done in maternal health and all of this, and thinking about her life and how her life, just because she was raped and had to have a baby out of wedlock, turned from the best, most a life that people would look forward to, look up to a life that was next to none. When Stella died, I walked up to an uncle of mine and told him that I'd lost my aunt, that my father's sister had died. And he said, "Oh my God, which one?" And I said, "Auntie Stella." This is an extended uncle. This is my family. He didn't know who she was. So Stella was also a secret. She was hidden from the whole world. She was a shame to an entire family. A big family that had money that could take care of her. When Stella got pregnant, they uprooted her from the city and took her to the village. So the quality of healthcare that Stella would have had if she was married to a good family and got the same pregnant, reduced to none. Stella could have died, being that she was 12. But we thank God that Stella had her children. Stella was forced to marry this 40-year-old man. Stella was constantly raped until this man died. This is from a family that is renowned, a good family. I'm not talking about people in the grassroots now. This brings me to why it's important to me. Access to young women. And I'm going to talk about it from the grassroots to even my level. Think about me. I thank God for my job, and I thank God for the HMO that gives me healthcare. But imagine if I didn't have a job, and I still lived under my parents' roof, and perhaps I felt the need to see a gynecologist. If I was to have the conversation with the people who are going to give me money, my parents, would I go? I won't. If you ask 10 women in my position, girls, who are about my age, who depend on their parents, that, okay, I want to see a gynecologist because I feel some type of way, they won't go to their folks. They will prefer to go to boyfriend. See how the link is now, right? This is people who are in quote unquote good positions in life, in strong families, in rich families, let alone people who have nothing, who are from the grassroots that we keep speaking about. What the problem is for me is our culture does a lot of things to children, particularly the female child. It teaches them, it loves them, but one thing it does not do is respect them. One thing it doesn't do is listen to them. We need to be listened to. The work that we're doing with MSD for Mothers is trying to understand the situations where women are giving birth in Nigeria, right? And one resounding theme that came out of our conversations during our research, a baseline survey, was death due to unsafe abortions. Another resounding thing was that young girls felt safer, not because of resources, to go to TBAs when they got pregnant, because they knew that when they got to the hospital, they would not be safe in hospitals. What are we doing to solve this problem? First of all, through our Giving Birth Nigeria project, we're spreading the word about all of these findings that are coming out. But one thing I'm really proud that Nigeria Health Watch is doing also is we started this year by thinking about how we can expand our reach. And our reach is usually professionals in the health sector and everything, but we're like, we need to do more because, this information we're putting out, a lot of these people in the health sector already know what's right to do. Why don't we start speaking to younger people? So we started having FGDs with the younger generations, particularly around sexual and reproductive health. And I have a few messages from them to you. First of all, we are having sex. We are having sex. Second of all, we need these services. Please, we do. Please don't chase us away when we come to the hospitals asking for condoms or asking for services because we're young. Listen to us. We are doing very crazy things now because we don't have these services. We are mixing 7-Up and Alamo bitters as birth control. We are drinking ash from charcoal to abort babies. Please listen to us. Thank you very much.
Thanks a lot. Thanks so much for that, and I think it speaks to why listening to young girls matters. And the reason why we believe this is so important. Perhaps I should go next to Tara, and because similar to the work that Nigeria Health Watch has been doing in giving birth in Nigeria, you actually were part of a global initiative to try to understand what women wanted in terms of care and services. What did you find out from a Nigeria perspective?
Privileged to be here. Thank you to Nigeria Health Watch. As an organization, we believe that when health system is responsive to the needs of women, it creates trust in the system and it creates increased demand for quality health care. And in 2017, we started a project in Niger State, White Ribbon, and our solution was simple. We wanted community platforms where communities can discuss their health problems and demand better care. And one of the examples we got from that was we had, in 2016, as part of the baseline, I had met a lady, Fatima, who had 3 kids and didn't have any of them at the facility. Fast forward to 2017, she was part of a town hall meeting, and we connect decision makers to community people. And she was part of a town hall meeting, and she had, one of the things that came out of town hall meeting is that facilities were not equipped, and so they were not going to the facilities. And Niger State government made a commitment to provide certain commodities and equipment I had gone to that facility some months after when Niger State had delivered those facilities to actually just confirm. And coincidentally, Fatima was at the facility giving birth, and that was her fourth child, and the first time she was delivering in a facility. Now, that told us that when healthcare is responsive to the needs of people, it creates trust, and then it creates better healthcare. Now, Fatima was a 38-year-old woman who had delivered 3 babies, but had never been in a facility. But when she had the opportunity to speak and be listened to, and government responded to her needs, she then went ahead and had improved quality by just delivering in a facility. And so we took that example and we created a global campaign called the What Women Want campaign. And our goal was simple. We wanted to reach 1 million women across the globe to tell us their one priority healthcare. And in Nigeria, it's amazing that these women, we reached 74,000 women in Nigeria. And women were just asking for basic things that we will think in this room every facility should have. And the top number 1 ask for Nigeria was wash. Women just wanted water and sanitation. Number 2 was respectful care. It means that women were just demanding for simple things to be respected when I go to a facility. Number 3 on our top 10 list was medicine and supply. For the 74,000 women that we reached, they kept telling us we wanted medicine and supply. And number 4 was women just wanted to be told what procedure they were going through. You know, just be told their rights and told how this procedure was going to happen and make them feel comfortable. So yes, it is for us, it's telling us that, you know, listening to women is important. And when you take these results, so it's not just listening to these women, when you take their opinions and their views and you shape your health investments and you shape health interventions, then of course the health system will be better. But we cannot continue to have a system where we need a campaign to listen to women. Our health system should be structured in a way that listening to women should be part of the system. I personally think it is sad that White Women Alliance had to have a global campaign to have those results. Now, if in a community facility, it is part of the system that at a certain day, the community and the facility actually have a dialogue and understand the women's need. We will need to have a campaign to do that. But we had to have a campaign to listen to women. And to me, that is really sad.
Thank you for that. And building on that, building on that, Dikechi, I wanted to ask you, in terms of how technology can actually help us, enable us to do that more routinely. We share the same passion that basically this should be, the way in which we practice, not in so much an exception. So how can technology actually help us in terms of doing this, potentially, based on the work that you're doing at Omami?
Omami, it's a digital platform. It's a mobile app where women have access to basic life-saving maternal and child health information, as well as access to medical professionals. Now, before we launched the app, with the help of USADF, we had the Omami SMS service where women receive personalized, timely, and accurate messages with regards to their health for pregnant women and for women with children within the age range of 0 to 5. Now, that SMS service stopped end of 2016, but we also conducted a survey to know how the SMS was of benefit to these women. And, a whole lot of them, the question we kept on getting was, okay, so you guys can talk to us, but how do we talk to you guys? Now, we thought about that. An app has always been somewhere in the plan, but we needed to make sure that the people we are building these apps for actually need them. So the results we got from that survey informed our decision to create the Omami app. Now, with technology, a woman does not necessarily need to go to hospital for every single thing and every simple thing. And a woman can also know when to go to the hospital. Now, I was just going through the app this morning, and a woman just said she's 12 weeks gone and she's sporting, and her mother-in-law is telling her not to go to the hospital because scan is not good for the baby. So she reported on the app on our mothers community, which is an online platform for mothers where they receive support from fellow women and from our doctors. Now, another mother actually believed, was of the same opinion with her. And the mother was like, you know what, don't go, scan is not good for you. But thank goodness our doctor responded, and I was like, sporting in pregnancy should be one of the reasons why you should go to the hospital, because it could be as a result of a lot of things. Eventually, she went to the hospital and she came back and she gave feedback. Now, as much as Nigeria, the state of, or the rate of maternal mortality is high in Nigeria, Nigeria is also a country where a whole lot of value is placed on communication. So technology with regards to providing quality maternal health care has been of a great importance, has been of a great aid to us, in the sense that we are leveraging on that to bring this healthcare to the convenience of these women. And apart from that, Omami is expanding to become a platform where not just women will come and share their journey, but also we are trying to include everyone who is part of this journey.
Okay. So, thank you very much. Ajay, I was going to ask you to build on this. So one angle that we know from a cultural point of view in the country is that religion plays a significant role in our culture. I mean, one of my mentors in the past used to always say that at any week at any time in the week, you have 70% of the population that goes either to the mosque or to the church. And therefore, I mean, that reflects basically that, you know, we are a religious country, and to that point, a lot of our decisions tend to be informed by some of our religious beliefs. To your point, in terms of the work that you're doing, how can we leverage on engagement with religious institutions to inform, so that women can inform the care that they want? Sorry.
So we pay advocacy to religious institutions,
Yeah.
the traditional rulers, and the peers, stakeholders. So maybe they have received trainings also. So it's on sensitization to women, or on sensitizing the health of household, to allow the wives to visit health facilities whenever the need arises. So we have women support groups in collaboration with maternal, newborn, and child health, MNCH too. So there are women of childbearing age, peer group. Mm-hmm. So we have weekly meetings with them, and they have their mentors to capture their experiences. One, visit to antenatal clinic, or delivery, or maybe routine immunization. So they share their experiences on the treatment they receive, maybe from the health workers, or the constraint, what prevented them. Well, maybe some, they don't like to go to health facilities. Mm-hmm. Maybe they prefer to visit traditional birth attendants. Mm-hmm. So they share experiences, and they say maybe the reason why they don't want to visit the health facilities is due to the negative attitudes of my colleagues. So fear of being shouted at, scolded, or maybe when they seek for help, they will not be rendered maltreatment, and so on. So forgetting that we are on business only for the sake, and we are being paid salary for the sake of the patient. If there are no clients or patients, will not be paid salary. So they share their experiences also on maybe the problem they encounter during childbirth, or maybe trauma, infection, retained placenta, and so on. And so we have with these community voluntary social mobilizers in collaboration with UNICEF. Maybe almost in Kano, we have 22 local governments. So we have this VCM that will go and track pregnancy right from maybe first trimester till delivery. From the onset of the pregnancy till delivery, sensitizing them, telling them the importance of visiting antenatal clinic, hospital delivery, routine immunization, and the diet in pregnancy with emphasis on personal hygiene, hand washing, and many related health issues. So, and they are asked to report to the hospital whenever they are sick. They should avoid visiting patent medicine vendors. They go to the hospital because there are some drugs that are contraindicated for these pregnant women. So we reach women maybe through these compound meetings, community dialogues, lectures. We go to maybe secondary school, women group, social events, this is like naming ceremony, wedding. So we reach women with lectures on health-related issues, or maybe danger signs in pregnancy that they should report to the hospital whenever they experience any of the danger signs, maybe bleeding, or heavy headache with blood vision, or fit, maybe fever, or maybe 2 weeks. There are many health-related activities, so we used to sensitize them.
On one hand, you're having all this information that's been given to them. So to what extent are they also having the opportunity to be able to share their experiences and their concerns maybe with those around them? Excuse me.
Yeah, they share their experiences with us, with the voluntary social mobilizers, with the traditional bus attendants, and their peers, the peer group. So they share their experiences.
Okay, great.
And then when they are mentors, again, we have mentors and they are facilitators.
Amy, can I come to you? In terms of the Experience of Wellbeing Foundation, how have you sought to elevate the voices of women, and how has that informed your programmatic work?
For the Wellbeing Foundation, the women are at the heart of the work we do. We believe in respectful maternal care. And in 2015, we began a program that put women at the focus of what we do. The program is called the Mama Care Antenatal and Postnatal Education Program. It is delivered by midwives. I always say that as a mother of 3 children going on 20, and a woman, sometimes if everything works well, if we eat properly, we have the right information and education, to be honest, we might not need to see a doctor. And no offense to the doctors in the room. But there are women who, in their rural communities, in my village, that will go through pregnancy and not see a doctor if everything goes well. They would see a midwife. And in some locations, they would see a TBA, traditional birth attendant. So midwives are the heart of our solution. We have midwives who are trained, who are hired by the Wellbeing Foundation, who are trained to meet mothers where they are. And I would tell you why that is important. We've heard from my fellow panelists about what women want, some of the issues. Many women would rather not go to a facility because have you ever been pregnant before? Your feet is swollen, you're walking like a duck. To be honest, you want to go to a facility that you don't know whether the person is slapping you or greeting you. Sometimes you don't need all of that. And in many cases, some women say, this is my second pregnancy, I know what there is to know. And in some cases, we have the millennium generation who says, I get everything from Google. But what we do in Wellbeing is we encourage the 8, according to the World Health Organization, need to visit the facility at least 8 times. So we encourage it. The average, I see you rolling your head, at least 8 times. There was a research that was done a few years ago that says, in Lagos, for example, the average is 4 times. Of course, we try to discourage that and encourage more. And women will come to a facility when they know that they have a listening ear, it's clean, it's accessible, it's not expensive, And quite frankly, when I come and I tell you that my back is paining me, you don't tell me, go away, are you the first person to get pregnant? Was I there when you were doing it? And so our mama care midwives meet them where they are, listen to them, create a safe space where they can share. In many of the facilities we are, and we are in both private and public facilities, we go to the public facilities, go on a typical antenatal day. It is like, I don't even want to tell you what it's like. It's like women, they're waiting for you to move. There's no seat for you to sit. In a typical antenatal facility where they provide. So many women, when they go there, they just want to quickly go, see the doctor, do their, what do you doctors call it? And leave.
Chike, what do you call
You can
it?
tell that I'm not a doctor, right? And they leave. And so we meet them there, use the opportunity to get information. That is when they tell you, my husband wants sex while I'm pregnant. I don't want to give him sex. What do I do? Don't ask me what we tell them. There's a curriculum for that. Or they tell you that my mother-in-law says I should eat this or I shouldn't eat this. And they're supposed to be eating appropriate nutrition, food, and they don't. And my mother-in-law says I shouldn't eat it, otherwise my child will grow, I will give birth to a child that is blind or something. You know, all sorts of information. So we meet them there, and also we do the online part. But what is critical about what Wellbeing does is we also find time, and this is keyed into the program of the foundation, to train healthcare workers in those facilities. And I'll tell you why that is critical. Imagine you as a midwife or a nurse in a facility, you are taking through mothers and they are coming in every day. You are probably underpaid, overworked. So you really don't have the time for interpersonal communication, which is key for a pregnant woman, whether you're a first-time mother, you're an adolescent girl, or you're a third-time mother, it doesn't matter. And we take the time to put the healthcare workers, nurses, midwives, and sometimes doctors on why this is critical for the journey of a mother from conception to after she's had her baby. And we've seen that that is so critical to the work they do. We've seen in a lot of changes coming out of that. Many of the private facilities ask us, can you come back? And when we do trainings for them outside of the facility, they say, can you come back to our facility and train our facilities? The government workers that we work with encourage us to come back and support them and give them that training that they need. And we see the changes in their attitude, in how they relate to mothers, in how they relate to the families of mothers, which is, again, critical. I will end with this story that we had. A few weeks ago, I was in Kaduna, where we had started a program. It's a program on infant and young child feeding, around breastfeeding. Why is breastfeeding important? Because we found out that many mothers are not breastfeeding. And a lot of children are growing up stunted, malnourished, and again, dying. And this program went back as far as even before a mother gives birth. As far back as when the mother is just pregnant, what do we need to do? We found out that many of the healthcare workers are not providing that information. The facilities themselves are actually culpable of providing and saying, oh, you can use breast milk substitute as opposed to feeding. So there was this particular mother in Kaduna who found that she was pregnant for triplets. I can't imagine. I had one child at the go, and I can't imagine thinking of feeding. In fact, from moment of conception, I would have said, these ones, they're not getting breast milk at all. But when she found out that she was pregnant with triplets, she immediately turned to this healthcare worker who we've trained. She was a midwife, the matron. And that healthcare worker was able to work with her through her journey of pregnancy to let her know that it is possible, it is doable, and heck, it is necessary for you to breastfeed your children. 3, 4, it doesn't matter. And these are the support mechanisms you need. And these children were born premature, 6 months premature. This mother pumped breast milk throughout. She breastfed them exclusively for 6 months. I just had to get on a plane from Lagos to go to Kaduna and see this miracle worker myself. But what was critical about that was we were not only, it was the healthcare worker was not only saying it was the mother that did it. Clearly it wasn't, because the father was a critical stakeholder, a critical person in the mix. And he told us of how he himself had to get educated by the healthcare worker. The healthcare worker, the midwife, I keep on saying healthcare worker so that I don't offend doctors here. The midwife of the matron went to see them 28 times from the period of February to March on her own, by herself, with her own money, to ensure that the mother was getting the support she needed. So it takes a village, people, to ensure that we have quality care. Thank you.
Thank you. And I just wanted to ask a follow-up question, but so briefly in terms of how do we capture some of the insights that you've all developed, and how do we actually feed this into the formal health system? So have you heard from the minister, there's a lot going on in terms of focus on quality of care, now improving our PHCs across the country, building new PHCs, etc. And to your point that you've all made, you clearly believe that this is an integral part of, the care delivery, quality care delivery. How do you think we should be thinking of, integrating this, or how can your work and all your insights, plug into the plan that the country has in terms of, delivering quality care? Briefly there.
Hi. Okay, so I believe that quality means that everybody gets a seat at the table. And what do I mean by sit at the table? Right now, we're here at this gathering because of all the work that me and my colleagues have kind of put into plotting and strategizing this seat, to have this conversation. Sometimes when you find your sit at the table, it's not necessarily the sit that brings the immediate, change. So for us at Nigeria Health Watch, advocacy is our sit at the table. We continue to bring out this information to the country. We continue to create situations like this, events like this, where we could sit down and brainstorm on how to move the topic forward, how people like all the strong professionals in the house can make a difference, an impact. But understanding your own sit at the table, and understanding that everybody, including the people at community, have the sit at the table, will inform how we even address them. Because sometimes when we go to these people, it's almost like we've come from the city to tell you how you're going to do it. And that doesn't work. You need to understand how you can make them champions of what dream you're trying to instill in them. I'll give you an example. During our baseline survey, we went to Ebonyi State. And in one of the communities we're working there, an organization called Armut. They have set up comprehensive centers in 3 different LGAs in Ebonyi State. So what they've done is they've had the community take ownership of this work. So down to building materials for the facility that they built, it came from the community. They are the ones who came, the handwork in terms of the blocks and everything. It now became their community. It now became their passion. They got a seat at the table. So for us, it's encouraging that everybody takes their seat seriously and everybody is given their seats with integrity, not just saying, you need to do this, you need to do this. Not just going to tell husbands, you must care for your wives. You need to give them a reason why this is very important, because we have all not come from the same backgrounds. So we all need to be encouraged to see our sit in the table that ensures quality. Thank you very much.
Okay.
So advocacy is critical, important. I'm not going to touch on that, although we can never touch on it enough. I would say for us here, data. Data, and heck, more data. Information is key because sometimes, like you rightly said, some of these programs is a feel-good. It's not a feel-good program. It's actually programs that are critical, and when we do work in those silos, it doesn't get out. So it takes a global campaign like What Women Want for us to know what women want. It shouldn't be. So the data is critical because the data feeds back into the system. And the reason why I say data is critical is data from the mother herself. So at the Wellbeing Foundation, we designed personal health care records that makes the mother in charge of her own care. So from the moment I come in, what does it mean when they say my blood pressure is this? What does it mean when they say by my body marks. She needs that information. She needs to know it. And that has to feed into the facilities information or the community healthcare information. And that has to somehow feed into the state information that we're getting. So many of the programs that we embark on or that we currently are doing, we find a way to provide those linkages to the state information. So we're working in 5 states, Kaduna, Lagos, Abuja. Those data, we make sure that we're at the meetings where if they're doing something in Abuja, we have our program in FCT, that the data we are getting from far facilities, Buari, Kuje, and I don't even want to know the rest. I do know the rest, I can't call them for you. But many of those facilities that they don't even have motorable roads, we make sure that we provide that feedback to the government and to the state to, 1, do something about it, 2, know that this is what is coming out. In this facility, they don't have water. When mothers are complaining that they don't have this, they don't have a functioning healthcare facility, and so on. And the third thing I would like to say before I hand the mic is, again, part of what is critical for us to always make sure is that the voice of the mother is never lost. At some point in time, I would like to see a table of mothers here, although we are all mothers, but and fathers, but I don't know how we want to do that, because again, we find that in many of this consultative process, we are speaking on their behalf. And yes, I'm a mother, but I don't stay in many of these facilities that or these communities that we talk about. And so whether it is through the community engagement, we bring those mothers themselves and the community people to community individuals to be able to clearly state and say what they mean. I don't know how possible it is in many of all these gatherings, but at some point in time, it's critical for us to bear in mind. Thank you.
Thank you. I mean, you guys are sitting on, I think, a wealth of data, all the information that you've collected, and the work that you continue to do. How do you plug that all into the health system in the country to inform care?
Okay, so for us at MobiCare, using our Omomi platform, we don't necessarily come in contact with these women physically. So everything they do, everything, their stories, they share on our app, on the mothers community, like I stated earlier. So at the moment, they don't have a tab or a feature on the app that allows them to score the doctors and even the health care workers they meet outside the app, because our app does not evict the place of the hospital. But they do this informally, like I stated earlier about the woman who had spotting. But going forward, we would be adding a feature to the app where they score our doctors. They even talk about the health facilities they've been to without necessarily name dropping per se, yeah, so that we don't have issues. And thankfully, with the partnership we got from MSD, would be bringing in AI, so that will help us to get more data and make informed decisions on that.
Okay, great.
For White Women Alliance, we're not just listening to women, we're actively advocating on the responses that we've gotten. We're leading the civil society advocacy at the quality of care, technical working group at the Federal Ministry of Health, where we're just not talking about this, we're also saying this is what the women are doing and this is what government needs to do to invest, to make investments that respond directly to the needs of women. And also for data, I think it's important that we understand that while we all care about quantitative data, the figures are amazing, it is the stories that drive the figures. It is the story of that woman, that girl, that give life to this data.
Yeah.
And so Nigerian Health Watch and all of us that are doing the work, we need to keep remembering that this data is important. 1,000 over 100 over 1,000 figures, very nice and all good.
Yeah.
But we need to still give life to the stories. It is the stories that give life to the data that we collect. It is also critical to understand that everybody is a stakeholder in quality healthcare service.
Yeah.
There's a community in Bauchi where everybody is part of the process. The transports, the Okada Riders Association, wherever they see a pregnant woman, they pick her for free. no pregnant woman in that community pays for transportation. That's an example of how a community has come together to say we need to take the issue of maternal health seriously. And so we need to take that example and continue to drive it. We need to bring the men into this conversation. We need to bring children into this conversation. We need to bring all of us, private sector, donors, government, to say that, for us to deliver quality healthcare in Nigeria, it's a conversation that all of us have to be part of, and all of us have something to deliver in that process. And so understanding that quality healthcare is not, we're the frontline drivers, we drive the process, but every person has a part in ensuring that quality healthcare is important. And while I said everybody has a business in driving quality healthcare, it's also important that as civil society people, as donors, we ensure that there's those platforms where communities can be part of the process. For instance, we are educating World Health Development Committees, creating World Health Development Committees at the community levels where they can serve as accountability platforms. And so it's important, it's interesting when we say every person is a part of the process, but where are those platforms where people's voices can be directed? That's another thing that we need to consciously think about and deliberately create platforms in communities, in neighborhoods, in our schools, in our communities where people can then be part of the process. For instance, we can create in estates on Tuesdays, Maternal Health Tuesday, and people can come together and share their health stories and see how the neighborhood facility can be improved. And so we need to also create those platforms. We need to go beyond just talking about it. We need to go beyond just advocating. We need to also bring the solutions and share examples of where success is happening. Thank you.
Okay. Anaja, same question to you. Given all the work that you're doing, how do we make this a more systematic thing and it plugs into the health system?
So first of all, let me mention the constraint maybe that is attributed to lack of utilization of a health facility, maybe the delays, there are 3 or 4 delays. For example, in my community, there is delay in seeking permission. Maybe the husband is not around, so the woman will not be allowed to go out. Some, especially women in Prada, even if they are going to lose their lives, they will not go out. They will not be taken to the hospital. And some that are not in Prada, they will need the permission, seek the permission of the husband, or maybe the notorious mother-in-law. These mother-in-laws that maybe they've never once in their lifetime visited health facility for antenatal, for prenatal care or delivery. So they are finished their own tenure and they don't want the young people to survive. So I don't know what to do with this. So we have to sensitize the mother-in-laws and anybody, all the stakeholders, to be allowing their wives or their children to be taken to the health facility for the treatment of ailments. Mm-hmm. So we have delays also in reaching. Mm-hmm. Maybe this problem of transport. Mm-hmm. You see, in some remote areas, believe me, you will even shed tears when you go there. It's very remote, no road. There is not a single road that will, vehicle will pass. Maybe there will be, when they are in labor, or maybe, our people, maybe some of them don't go to the hospital unless if the condition is critical. So they will carry them on wheelbarrows, maybe, or donkeys. So before they come out from the area to get transport, and maybe there will be no transport at all.
Yeah. And so how do you make sure that basically...
Or maybe when they reach the health facility, there will be great delay in receiving the health care. Maybe the health worker is not around, or no drugs, or maybe she will not even attend to the cases.
So all those insights, how do you make sure that basically that kind of insights, and if things don't change, get repeatedly to the ears of those people that can make the decision to change that? How do you make sure that that happens, until it changes and until basically we make sure that that is the norm, not
we create awareness. We create awareness to mother-in-laws, to the husband. So a rural community, and they should be given free health care. Mm-hmm. Free health care, because that's the problem we have been encountering. during the polio implementation days. When you visit a household, they will say they don't want it. Why should they reach their doorstep with OPV, oral polio vaccine? But when they go to a hospital, common paracetamol.
They can't help.
They will not be given free, it's on sale, so they have to pay. So we create awareness. And then to young mothers, free routine drugs also to pregnant women. They give them free routine drugs, free antenatal care as a hormone. Not only, so the blood donation, maybe, donation of blood. The communities can donate blood, and maybe some people will donate vehicle, or government should donate ambulance to be conveying them to the health facilities.
Thank you very much.